In Season 2, Episode 3, we discussed how improving nursing workforce engagement can be accomplished without adding organizational costs. We provide one example of this in today's episode, where I speak with Cheyenne Fisher, Chief Nursing Officer and Chief Operating Officer at Health First. We discuss improving the bedside work-life experience through supply chain modernization. So let's get started.
Welcome to the BRG Nurse Executive Podcast. BRG is a global consulting firm that helps organizations in disputes and investigations, corporate finance, and performance improvement and advisory. BRG's healthcare performance improvement practice offers multidisciplinary services to healthcare organizations. We focus on implementation with innovative, independent, and data-driven solutions. In the BRG Nurse Executive Podcast, we discuss improving patient care by advancing nursing leadership. For more information about BRG, please visit thinkbrg.com. Now here's your host, Nick Shimalewski.
Cheyenne, thank you so much for joining me today.
I'm glad to be here.
So I understand that Health First determined that they were having some challenges around their supply chain process and wanted to make things better for the frontline nurses and the frontline staff. Can you tell me a little bit more about that?
Sure. I think, like probably most healthcare organizations, the recognition that having supplies in the right space at the right time is significantly impactful to the work that happens at the bedside with our patients. And we had some opportunities around that. Some of it was the organization of the supplies within the actual rooms, but also it was the replenishment of those supplies. We look to our partners in supply chain to help us optimize that space for our clinicians at the bedside.
Aside from just using the word optimize, what was the ultimate goal for the frontline staff and what you wanted to achieve from a consumer experience?
So for the frontline staff, optimal work environment means that when they go in to get the supply they need, they don't have to hunt and gather. They know it's going to be there without fail. They know that without fail, it's going to be not expired, it's usable, and they can get it and return to patient care quickly.
And so I assume then that if that's the desired state, all of the things that you just mentioned were some of the opposite of that, were some of the challenges that you were experiencing, the problems that you wanted to solve. Is that an accurate assumption?
That's fair, Nicholas. Yes.
Okay. I'm thinking about leader rounding, and one of the key questions being for frontline staff and even for nurse leaders of, I have the tools that I need to do my job. And this clearly sounds like that was a barrier that you were trying to overcome.
Absolutely. In some of our units, we've got one supply room, which means they have to walk to get there. We can't do anything about that. So being able to optimize that space so that when they do have to travel to get what they need, decrease the workload and the time frame in order for them to get the things they needed.
What were some of the financial goals that you were looking out to achieve as you embarked on this project as well? Because clearly, spending more money is not something that we can do right now. When we're talking about optimizing, we're normally looking at ways of cutting costs. What were some of the things you were trying to achieve with the project in that regard?
Two things really. Number one, if we have the right supply and the right quantity, the right size, we waste less because we use the right thing and we don't have to open extra things. So less waste. And then less expired outs. So if we have a good system where we're using those that are close to expiration before those aren't, we waste less. So those were the two key areas that we really look to make improvements in.
Okay. And so walk me through the process that was utilized or what your experience was as the chief nursing officer with this supply chain redesign.
Transparently, I got out of the way of the teams that actually are impacted by this work. So executive supporter, totally agree with the project and support the project, but I let my directors of nursing and my frontline managers work with supply chain to prioritize the areas where we implemented the new system and then work with them directly to individualize per space when it could be done, i.e. an ICU versus a med surge. They're going to look a little bit different. But so I got out of their way and let the teams do that work with supply chain.
Let the people that are it's going to be impacting the work do the work to make their work life environment better.
For sure. You don't want me designing your stock room. You don't.
Right.
Yeah.
And so what role did the nursing directors have then in talking about how their stock room would be designed? Because the way that a supply chain professional lays out a supply room versus the way a nurse or a bedside technician may lay out a supply room are probably pretty different.
They are. However, that's where partnership and collaboration are key. It's important for the nursing teams to understand that in order for our supply chain partners to truly support and optimize the correct environment in that room for them, we need to understand why their workflow is important. And the same goes for supply chain. They really needed to understand if a nursing leader came and said, I need X, Y, and how can we make that work? That's what the director's role really was, is really the collaborator between supply chain and the frontline nursing leader and staff.
And again, this is going just along with transforming care at the bedside mantras from AONL around breaking down the silos and letting the people that do the work understand each other's world and how they're operating.
100%. If you ask any member of my team, I will not support a project if I don't have frontline nursing or nursing leaders involved in the project. It doesn't make any sense as we move forward. We've got to get out of their way and let them have input through shared governance and having a seat at the table. Otherwise, we've actually solved no problems. We've probably created more for them.
Certainly right in that regard. So the frontline staff get together. How long did the process take from when you decided, hey, we need to change something to when you actually were implementing something? How long did that take?
I think I'd have to defer to our supply chain leaders from the time we wanted, recognized that we needed a new system into the time we got to the place where we were implementing. But once we began implementation, it was very short. It was weeks to months to have an impact.
Okay. And so let's move to the secret sauce then about this system. That's the reason why we're talking about it today. It's called the 2-bin Kanban system process or the 2BK process. I'll be honest, I've not heard of it until we scheduled this podcast. What is it and how does it work?
Quite simply, it's 2 bins for all of the supplies that we need. And the first bin, when it's completely empty, triggers restock, but you already have the sufficient quantity needed sitting in that second bin before the restock can occur. So it's this perpetual movement of inventory that assures you never run out of the supply that's in your stock room.
Sounds too good to be true. It's so simple.
I said it. It guarantees. Of course, if there are shortages and other things like that, we can't impact, but it means the process flow from receiving supply to the point of care or the point in which the clinical team needs it ensures that it remains stocked and full.
How often are your staff making phone calls nowadays for we're out of X, Y, and Z?
They don't. Our supply team are in our stock rooms at least twice a day.
Okay. So at the very least, if we finished one bin and we've started using the second bin, that first bin is getting replaced at within 24 hours at the latest, but ideally within about a 12-hour time period.
Correct. And each one of those bins contains the quantity of that supply based on our historical utilization so that we can predict that 4 kits for Foley insertion are used on this unit every 24 hours. So that ensures that they have enough for the 24-hour period. So if supply chain isn't in the room, they're still not going to run out.
Wow.
Yep.
Again, it sounds too good to be true, but hey, that's a great solution. What's your supply room environment of care? Sometimes when you walk into a hospital's supply room, it looks like a bomb went off, and you've got other ones that look completely sterile, like you're in the middle of an operating room, but yet you hear from staff it's so difficult to find things. Where does it fall on both those things? Overall aesthetics and then just ease of use?
As you can imagine, with 4 hospitals, we have a combination of everything that you just described. But as we've gone through this process, couple of things. Number one, getting everything elevated and off the floor so that when we do clean, when our environmental services team is in there, we can completely clean the entire floor. So this stuff does get dropped or opened and then the trash remains there. So as we progress through this, that's been one of the things. Secondly is color coding. And then the third thing is removing all of the extra stuff that ends up in supply rooms that creates just junk everywhere. So some people moved cabinets into their supply room. So we've moved them out. And it's really a standard approach to having only the bin system in our supply rooms.
What's your process for low use items or items that don't get used a lot? For example, bedpans are probably used a lot, but maybe some unique equipment or Coudet catheter, let's say, is not used with as regular frequency. What's that look like on a nursing unit?
First of all, again, back to the utilization and our historical utilization, they ensure that we don't stock significant quantities of those low volume supplies. And some of those we purchase in bulk quantities. So at the point on which supply chain receives them, they break them into the quantities needed in each of the areas. So if it is something that is a truly low utilized supply, the team's only going to have what we've estimated based on their utilization in that supply room. And again, that ensures that we don't have expired supplies sitting around and that we can manage the inventory tightly and not over order.
And so we asked earlier about the cost savings opportunity. What were your outcomes on the financial side after implementing this process?
We're still in the implementation phase, so not all of our units have the two-bin system, but the units that we have fully implemented, we're seeing about a 50% reduction in the supply expense in those areas, which is over about a 300,000 in cost reduction each year.
Wow. So we really are making things better for the frontline nurses at a cheaper cost.
Absolutely.
I had Jeff Doucette, who's the chief nursing officer of Prescaney, on a recent podcast episode. These are some of the things that we were talking about. It's not going to cost you money to make your work life environment better. This is actually costing your organization less money. And I'm wondering, have you seen any changes in your nursing engagement scores related to this process?
We do engagement scores one time a year with our team. So we have not resurveyed them since we began the implementation of the two-bin system. However, what I can tell you is in the areas that have been implemented, that their work day is getting better. It's easier. There's less frustration. There's less hunting and gathering. And they will tell you that when you round on the unit and ask them how it's going. So while I don't have specific data that shows it yet, we can feel it in the units that it's been implemented.
Can you talk a little bit about the role of the nurse leader in engaging work teams around this?
Sure, nursing leaders think it's not worth the investment of their time because they don't see hard savings with it. You do way over there in supply costs, but you don't see hard savings with your team. We don't count their hours like that with how many steps they take. As we all know, the role of the nurse leader has significantly changed in the past couple of years due to a number of factors. And engaging staff at the front lines when we make process change is important. But the second key component of nurse leadership that's also important in a large project like this is what I spoke about earlier with the collaboration with other units and being able to demonstrate the value to the clinical team of why we're making changes. We often miss that with our team and we share with them it's a financial win, the financial good to do for the organization. And the reality is that's not how our clinicians think. And being able to have them feel differently in their day about their workflow, the intensity of their work, and the hunting and gathering was the key perspective around the why from the nursing leaders that got the buy-in from our teams.
Any closing thoughts?
I'm excited to see this fully implemented across all four of our hospitals. And I'm more excited to come back in about 6 months after that full implementation to potentially get a true return on investment for the work time for our nurses at the bedside.
Thank you so much, Shayana, for informing me on all things about this two bin Kanban supply chain process. And more importantly, about how it improves the work environment for the frontline staff. I really appreciate it. I learned something. And for our listeners, for more information, there's a link in the description that'll take you to an article about the tubing Kanban process.
Thank you, Douglas. It was nice to talk to you today.
You've been listening to the BRG Nurse Executive Podcast, which focuses on improving patient care by advancing nursing leadership. The views and opinions expressed in this podcast are those of the host and podcast guest and do not necessarily reflect the opinions, position, or policy of the guest employer, Berkeley Research Group, or their other respective employees and affiliates.